In part 2 of chapter 12, we're going to continue with head and spinal injuries, focusing more on parts of the face, such as the eyes and the nose, ears, etc., to determine what to do with those type of injuries. Eyes can be damaged by trauma, and an ophthalmologist should and examine the patient as soon as possible after an injury. You can look for different things such as a black eye, if the person was hit by a fist or a ball or some type of object, if there's a broken bone around the eyeball, and you can know that by double vision or an inability to look upward. You need to apply an ice or a cold pack for 15 minutes, but don't place it on the eye. Put it around the eye. Have the person keep their eyes closed and seek medical care. If there's loose objects in the eye, there might be severe pain and tearing. Have the person blink several times. Pull the upper eyelid out and over the lower lid and irrigate with clean, warm water. Examine the lower lid by pulling it down gently. Lift the upper eyelid and over a cotton swab. With penetrating eye injuries, you want to look for any lacerations or cut on the eyelid. Don't remove the object. Place padding around it and cover it with a cup. For short objects, place a donut-shaped pad around the eye. Wrap the bandage around the head to hold pad in place. Cover both eyes. Have them lay flat on their back and call 911. If there's cuts on the eye or the eyelid, look for the appearance of the cornea, a cut appearance of the cornea, and inner liquid filling the eye coming out through the wound. Also look to see if there are any cuts on the lid. Do not apply pressure to the eye. Cover both eyes with gauze pads, and you can wrap a bandage around the head to hold it in place. Call 911 or drive the person to a medical facility as soon as possible. If chemicals get in the eye, hold the eye open, flush with warm water for 15 minutes or until EMS arrives. You can bandage it loosely and contact poison control center so you can determine what type of chemical it is and what the severity of the damage can be. With eye avulsion, look for eyes that are knocked out of the socket. If you see that, cover loosely with sterile dressing moistened with water. Protect the injured eye. Cover the undamaged eye with a patch and call 911. If there are burns to the eye caused by light, look for reports of looking at a source of UV light, for example, or severe pain occurring 1 to 6 hours after exposure. Cover both eyes with cool cloths, give pain medicine, and seek medical care. With ear injuries, most of them are not life-threatening. Only disc batteries and live insects must be removed immediately. First aid providers should seek medical care for the person. Any object stuck in the ear, do not use tweezers unless the object can be seen near the ear canal opening. Have a medical professional remove it. For live insects, if the insect does not crawl out, pour warm water into the ear and drain it. If the insect cannot be removed, seek medical care. If fluids are coming from the ear, do not attempt to stop bleeding or anything coming from the ear. Place a sterile bandage over the ear and keep it loose. Stabilize the head and neck and call 911. With nose injuries, most nosebleeds are self-limiting and very rarely require medical attention. Sometimes if there's a head or neck injury that is occurring with the nosebleed, you need to stabilize the head and neck for protection. I had a friend who used to get nosebleeds all the time, and hers would not stop. She had to go to the hospital and they had to pack her nostrils with gauze, and she, could not treat it on her own. So nose injuries, although not life-threatening, still may need attention from medical personnel. If the nose is broken, there might be pain, swelling, bleeding, unable to breathe through the nostrils, or black eyes may appear a couple of days after the injury. If it's bleeding, provide care. Apply ice packs for 15 minutes. Do not try to straighten a crooked nose. With nosebleeds, look for anterior nosebleeds and posterior nosebleeds. If the nose was hit, suspect a broken nose. Have the person lean slightly forward and pinch nostrils for about 10 minutes. If the bleeding does not stop, have the person gently blow his or her nose, pinch the nostrils shut again for 10 minutes. And then if bleeding continues, you need to try other things. After a nosebleed, try sneezing through an open mouth. Avoid physical activity. Elevate the head when lying down. Keep your nostrils moist and don't pick or rub the nose. If there's a foreign object in the nose, gently blow the nose while compressing the opposite nostril. If an object is visible, pull it out with tweezers. Otherwise, seek medical care. There is sometimes problems with teeth. People can report something is caught between their teeth, but try to remove it with dental floss. If unsuccessful, see a dentist. With people that bite their lips or tongue, look for pain, swelling, bleeding, apply pressure, clean the area, and if the bleeding doesn't stop, you need to seek medical care. With loosened tooth, apply pressure on either side of the tooth, and tooth movement indicates a loose tooth. Have the person bite down on gauze and call a dentist or oral surgeon. For a toothache, you might have pain or sensitivity, can be from dental decay. Rinse the mouth with warm water. Use dental floss to remove any food. Give any type of drug such as acetaminophen or ibuprofen for the pain, and seek a dentist. With broken teeth, collect the tooth or teeth fragments. Rinse the mouth with warm water. And if they're swelling, then place ice pack on the outside of the cheek. If the jaw is fractured, you need to stabilize the jaw and seek a dentist, and bring the fragments of tooth with you. If the tooth is completely knocked out, attempt to reimplant the tooth. If unable to reimplant, then put it in a Hank's balanced salt solution, egg white, coconut water, whole milk, and see a dentist. If there's an infection in the tooth, look for swelling of the gums, foul breath, and pain. Rinse the mouth several times a day. Give pain medication and see a dentist. With cavities, there's sensitivity to heat, cold, or sweets, or even to the touch. Again, rinse the mouth with warm water, apply oil of cloves, and seek a dentist. When you're bleeding from the mouth, allow the blood to drain out of the mouth. For a bleeding tongue, put dressing on the wound and apply pressure. For a cut through lip, place rolled dressing between lip and gum and press another dressing against the outer lip and seek medical care. So that's going to do it for most of the injuries in the head and face, and we are going to continue in part 3 with more on spinal injuries.